my name is Laura BUCKWELL, this is Annabelle, who is now 4 months. And we noticed that there were a few problems at the beginning actually, when there were sort of clicking sounds when she was feeding. And also she's been very, very gassy as well, which has been quite a problem throughout the 4 months. Also her latch hasn't been 100% either. And it's mainly sort of the gassiness. However, she has put on a lot of weight, so that's also been quite a distraction, because we didn't really know what was wrong. So it was only until we went to come and see Dr. Medhat for her first checkup that he realised that there could be a high probability of tongue tie when he checked her, you see. And it was only until he actually checked in her mouth that we actually saw that there was a problem.
When Laura brought Annabelle to me, she had few complaints. One of them is when she's nursing, she has some pain, not severe pain, but some pain. The latch is not perfect. She had clicking noise, and she has lots of digestive symptoms, mainly burping a lot, very gassy, and started to have reflux. That really raised a red flag to me, because we see this, usually these complaints, when someone has a tongue tie or tongue and lip tie. So after I checked Annabelle thoroughly, I found that she does have lip tie and tongue tie. So I explained to Laura that this is better to be released surgically sooner rather than later, because the healing process will be better if we do it early, and also less suffering for Annabelle and for Laura. If we don't do it also, then we can face problems later on. Like the breastfeeding will suffer. Later on, when we introduce solid foods, she will not be able to move her tongue well and to move the solid foods to be, swallowed and to have, a good process. Later on, if it's not done also, the pronunciation of some letters can be affected, especially the R and the L. I see some older children that got missed. They will say, instead of saying lollipop, they will say wowie pop. They will not pronounce the R well. And that also can cause lots of problems for them in school and to be bullied, and major problems. Later on, if this is not corrected, it affects the jaws themselves and their facial bones. So they will end up having braces done. In the future also, this joint, we call it the TMJ, will be very stressed and painful, and they are candidates for migraine headaches in the future. Okay, showing you, here is the tongue tie, attaching like a very thick cord, attaching the tongue from the middle to the floor of the mouth. Everyone has a frenulum, but it should be very thin and goes from the back, the back of the tongue to the floor of the mouth. In this case, it is very thick, and from the middle of the tongue to the floor of the mouth. Explaining about the procedure for tongue tie and lip tie surgical release, I usually numb the area for babies with numbing gel that will really help minimize any pain during the procedure. The procedure anyway is very quick. It's called radio frequency, and the equipment is attached to this, like a pen that's attached to a sterilized tip that you can barely see the tip of it. It will vibrate like hundreds of thousands a second, that will generate a gentle heat that will help to melt the extra frenulum, okay, and seals in its place without bleeding and without stitches. It's a very quick procedure, and it's the best equipment for this purpose and with the best healing, as I said. Using the radio frequency very gently, it creates heat that will melt this gently and seals in its place. So we go close to the surface of the tongue to avoid, this is very delicate surgery, and it has to be done by an experienced doctor, because there are so many blood vessels here, and also you see here there are salivary glands which we really don't want to come nearby. So very meticulously we should start close to the tongue down to avoid touching blood vessels or the salivary glands here. Usually the procedure takes about 10 minutes. The procedure usually takes place, as you see, in our clinic. We have a special room, and usually 2 nurses will assist me in this procedure. And I always advise the parents not to be in the room, because it's not easy to see a surgical procedure done on their baby, and in the same time I will worry about the parents. Sometimes parents cannot stand seeing surgical procedure, so I want to concentrate on the procedure with the baby and not to be worried about a parent in the room. I also like to tell the parents that it is normal for this to heal. In few days they will see a white layer at the site of the surgery, either under the lip or under the tongue. That's completely normal. That's the healing process, and it's not infection. After the procedure, the parents will have to have Adol drops for pain, as we described. In the first 3 days, can be given 3 times a day if the baby seems in pain, and will be needing Dentinox teething gel to numb the area for pain. Will need coconut oil to lubricate the area before massaging. They will need a box of gloves and gauze to be at home. We always advise the parents to do something called stretching and massaging of the upper lip and the tongue. Otherwise, the healing process will happen so quickly that it will reattach. So to avoid reattachment, we have to do stretching and massaging. Now, the first stretching and massaging will be done tonight, the night of the procedure, and the next day morning we'll start to do it every 4 hours round the clock if possible for the first 3 weeks. Okay. Now, before doing the stretching or massaging, it will be very wise to numb the area with the Dentinox teething gel. Okay, so the mom can put a little bit on her finger while she's wearing gloves, and it's very important for the mother or the parent to trim their fingernails so that it will not cause any bleeding, the fingernail, the tip of it. So it's so important to do stretching and massaging for the lip if we do lip tie surgery, and the tongue if we do tongue tie surgery, because this is essential. Without doing this on regular basis every 4 hours after the procedure, very likely that the tongue and the lip will reattach, and that's what we don't want. So today we'll demonstrate on Myrna, our lactation consultant and dietitian at myPediaclinic, how to do the stretching and the massaging for the lip and for the tongue. Now we will start with the stretching and massaging of the lip. To do the stretching, we have to elevate the upper lip and pull it as far as it can go towards the nose and count to 2, like 2 seconds, and then down, again up, 2 seconds, and then down. We repeat this 10 times. To do the massaging for the lip, you elevate the lip and you go up to the diamond-shaped wound at the end where the attachment of the lip and the upper gums, and with your finger you go up down, left, right. Up, down, left, right. You do that 10 times. When it comes to the tongue is stretching is a little tricky because you elevate the tongue and you push with your 2 index finger back towards the throat while the tongue is elevated. On both sides of the wound, back towards the throat. You do that 10 times and you take your time doing this. After a week, you will add another stretching other than pushing the tongue on both sides backwards towards the throat. You will also add 10 times with your index finger on the wound itself, pushing the tongue back towards the floor 10 times. When it comes to the massaging of the tongue, we elevate the tongue and at the attachment of the tongue with the floor of the mouth where the wound is, diamond shape will be, you go up, down, left, right. Up, down, left, right, 10 times.
Happy, baby? Hello! Hello! How are you? Oh, she's not crying or anything. I was expecting her to literally get floods of tears. How are you? You okay? What happened? What happened? Oh, come on then. Shall we go and feed her? Shall I go and feed her now? Yeah, okay. There's nothing, different at all. How are you? You okay? Oh, I know. I've just finished the surgery. I've just finished feeding her as well. She seems absolutely perfectly fine, having a good sleep. Hopefully she's going to wake up just as content. And I know I've got a lot more homework to do, which I'm going to go and have a look at now.
All right. Thank you, Laura.
Thanks for looking after her. Very pleased. And amazed how quickly it went.